My name is Renata Machado Pinto. I'm a professor at the Federal University of Goiás, and I'm going to present the research, The Impact of COVID-19 Pandemic on Children's Eating Habits. We don't have any conflict of interest. We know that the COVID-19 pandemic brought the need for us to make social distance measures, and among them, we have the closure of daycare and schools. As the children spend more time at home, there was an impact on all aspects of the children's routine, such as screen time, the sleep, physical activity, and also the eating habits. The objective of this study was to assess the impacts of the quarantine imposed by the COVID-19 pandemic on children's eating behavior. This was a bibliographic review. We used these databases and used the descriptors child or infant, feeding or eating, behavior or habit, pandemics or COVID. Our inclusion criteria was to read all the original articles written in Portuguese or English. And we see that the isolation of children bring various impacts on the health of the child. It's a complex interconnection of several factors, and we have more adiposity, more obesity, difficulties in the changes in the diet quality that can bring also obesity or food insecurity. We have seen a food paradox during this quarantine, a concomitant occurrence of obesity and food insecurity. We know that the quarantine and the isolation is associated with anxiety, anger, and stress. They bring an unhealthy lifestyle that include more caloric intake and combined with obesity. On the other side, the lockdown had brought many adults to lose their jobs, so the income of many families was diminished, and that brought food insecurity for some families. Surveys regarding quality and food security showed that there was more consumption of red meats, processed snacks, sugary drinks, and less consumption of fruits and vegetables. At the same time, there was an increment of 20% of families with children, small children, who reported low food security. And that was even worse in those who were already insecure before the pandemics. We observed that 30% of families who became food insecure and 44% of those who stayed food insecure preferred less total food at home. And this image shows that it was really worse for those who were already in food insecurity before the pandemic. Besides that, parents are also very concerned about child overweight, and they should be, because pandemic brings more risk factors for obesity, such as disrupted family routines, sleep dysregulation, reduced physical activity, increased screen time, increased access to unhealthy snacks, and less access to appropriate proportionate meals through school. And all of these risk factors impact in obesity rates. These are data made with 300,000 patients at the Children's Hospital of Philadelphia, aged between 2 and 17 years, and they made a clinical evaluation every month from January 2019 to December 2020, and obesity rates increased across all age ranges. And pre-existing disparities appear to have even worsened during the pandemics. Obesity rates were increased, especially in adolescents and non-white adolescents, and in those who had lower income, family income, and used the public system of health. We also have another paradox, the shift of habits during quarantine. There was an occurrence of more unhealthy and healthy habits. What's that? The feeding habits after pandemics. There were some surveys show that 30.9% reported improvement in their eating habits. At the same time, 24.8% reported worsening of their eating habits. 48.8% reduced the fast food consumption. We also see more dietary supplementation for many vitamins. The COVID-19 perceptions have pushed parents into more adoption of healthy eating behavior, so as a way to support the family's member immune system. People also change the way of shopping and preparing food. They're more connected the to the environment and to know what's happening. They were greater interest in reading labels, learning about where foods come from, understanding what ingredients are in foods, and which foods they should avoid. This family survey conducted in Canada with 254 families, they saw other habits beyond the eating habits, and at the same population, they saw healthy and unhealthy habits, such as more snack foods, more screen time, less physical activity, but more cooking time and cooking in such a way we're going to see here in these pictures. We can see that they are eating more snacks, but not from fast food. And some parents refer they're eating more fruits and vegetables. They're spending more time cooking with making meals with the children and involving children in preparing the meals. They also assessed other habits, and it caused me attention to see that the whole family is spending much more time in screen time. So we conclude that the restrictive measures to control the COVID-19 pandemic are associated with the regulation of children's eating behaviors, causing an increase in the consumption of processed and hypercaloric foods. This dietary change associated with worsening of other habits compromises the children's health, mainly because they induce obesity and its complications. Paradoxically, there is concomitance of food insecurity, particularly in low-income families already vulnerable before the pandemic. Some families have adopted healthier eating behaviors as a way to support the family's member immune system. And comes the question, what can we do? Since the pandemic exposed the need for larger policy changes that systematically addresses the complex environmental determinants of dietary habits, we who works with health workers, we should promote virtual activities that encourage physical activities and connect the families to nutritious meals. The main bibliographic references used to this presentation are listed here. And thank you for your attention, and here you have my contact.